At the 2015 Conference on Retroviruses and Opportunistic Infections, Dr. Ronald Baldessari asked a number of colleagues to share their perspectives on the research being presented. Here is one perspective.
Hello, this is Dr. Ron Baldessari reporting from CROI 2015. There are a number of federal leaders attending this important scientific conference, and we've invited them to share their observations and perspectives about the science being presented here.
I'm Laura Cheever. I'm the Associate Administrator of the HIV/AIDS Bureau at the Health Resources and Services Administration, and we administer the Ryan White HIV/AIDS program.
Could you tell us the main message from this poster?
Yes, the main message from this poster is that when you look at different payer sources for HIV care for people in the United States, we find that receiving care through the Ryan White HIV/AIDS program leads to improved outcomes over other payer sources. And now I'm going to talk about that in a little bit more detail. So this study is based on data from the Medical Monitoring Project, which is a surveillance study funded by the Centers for Disease Control, and they take data that's extracted from medical records and patient interviews. These data presented here are from 2009 to 2012. And what they found is they looked at outcomes of HIV care and treatment based on payer source, how that care was funded. So for when we compared patients that are only funded by Ryan White. These are patients that are completely uninsured and have huge barriers to care. Things like homelessness, mental illness, substance abuse. They have no form of medical care or coverage. And we compared to how they did to patients that were either privately insured, patients that received Medicaid, Medicare, or a combination of Medicaid and Medicare. And we looked at two types of outcomes. Those patients that were prescribed antiretroviral treatment, which is critically important in HIV treatment, and patients that had excellent outcomes from being prescribed antiretrovirals, meaning they were virally suppressed. Now, viral suppression is critically important because patients live longer, live better and better lives with higher quality of life, and are much less likely to transmit their infection to others if they are virally suppressed. So that is the main outcome we have in HIV treatment. So what we found in the data are patients that are only supported by Ryan White funding, meaning they're completely uninsured. About 94% of them were prescribed antiretrovirals. And this was significantly better than those that were privately insured or those that were receiving Medicaid, which is surprising because completely uninsured patients have so many barriers to care. And this really demonstrates that the Ryan White program works in helping patients access care and treatment, which is what we want out of this federal program. And then they looked at viral suppression. And once again, we found that if patients that are completely uninsured have viral suppression rates that are very similar to those that are privately insured and better than patients that are funded through Medicaid. Now, the next part of the analysis is looking at a critical part of the Ryan White program. So many people think that Ryan White is just for uninsured patients, and it's a critical part of care for uninsured patients. But the Ryan White program has a very important role to play for patients that are privately insured or are getting Medicaid or other forms of insurance, because the Ryan White program funds a system of care. Insurance funds a series of discrete services. So because we fund a system of care, we wrap around other forms of coverage and insurance to make sure that those people are engaged in care and are retained in care on antiretrovirals. So we wanted to look at when a patient's receiving just Medicaid versus a patient who's receiving Medicaid plus Ryan White, is Ryan White, that wraparound services, an added value in terms of outcomes? So this is what the second part of the analysis looks at. So here we see that a patient that just receives private insurance for coverage, about 90% were on antiretrovirals. But those that received private insurance plus the wraparound of Ryan White, which is what the purple is, had a 96% rate of antiretroviral receipt. Similarly, we saw similar improvements on Medicaid patients and Medicare patients and dually funded patients. We found the exact same pattern when we looked at viral suppression. So a patient that is privately insured had about a 76% rate of viral suppression. When we wrap around those Ryan White services for patients, their viral suppression rate goes up to 79%. And once again, we see that same pattern for other insured patients. So in conclusion, the main points of the study are, one, that the Ryan White funding is incredibly important for uninsured patients, completely uninsured patients, that they have excellent access to antiretroviral treatment and outcomes of viral suppression when they receive Ryan White services. But in addition, Ryan White plays a very important role for patients that have other forms of coverage, like private insurance or Medicaid or Medicare, and that adding that complementary system of services that Ryan White provides, in addition to the discrete services they're funding through their insurance, they have improved outcomes. This is Laura Cheever. Thank you.
For more information about the conference, visit www.croi2015.org. And for more information on federal HIV programs, visit aids.gov.